And we've seen how patients with COVID require special care on many levels. And joining us to talk about that is Subramani Seetharama, Medical Director of the Hospital of Central Connecticut Spine Center and Chief Physical Medicine and Rehabilitation. Doctor, welcome.
Thank you for having me.
Tell us how you're able to care for patients recovering from COVID-19. What is the rehabilitation process like?
So it's an interesting change because, as you know, rehabilitation is a lot of face-to-face contact. But right now, Hartford Healthcare is COVID safe. We are able to provide rehabilitation services, and my physicians can see these patients through the continuum, starting in the inpatient, through inpatient rehab, whether it's home care, whether it's nursing home or outpatient.
So patients with COVID-19 are all affected differently. How does that change perhaps the rehabilitation therapy from patient to patient?
Very good question. So that's what we are trying to do, is assess patients based on the medical risk, and then we kind of find out what their functional deficits are. So based on those risks, we can figure out whether they need physical therapy, occupational therapy, cognitive therapy, and whether varied services. And once they get discharged, we provide those services. Now, if the patient is COVID positive or are suspected of having COVID, they are in isolation. So we have virtual health services. We have telemonitoring through our home care that can provide the services to the patient. We educate them on home exercise programs. If they are COVID negative, they are welcome to come to our outpatient setting. In the nursing home setting, it's the elderly, high-risk patients. We work collaboratively with the geriatric specialists and the therapists on site to provide care for these patients.
Let's talk about how important the rehabilitation process is, not just for COVID patients, but for everyone who may have had surgery but may be reluctant to take part in rehab for fear of COVID exposure. So
again, post-surgery, our greatest impact is making them mobilize, making them move. So if patients go home and are not getting direction, they are going to fall back in their recovery post-surgery, whether it's spine, whether it's general surgery, whether it's neck surgeries. So we are providing them with an education pamphlet with exercises. Our home care specialists, if they go home directly, are following through to see that they are doing those exercises. If the patients are okay with our specialists coming into the home, we come in with proper CDC precautions using masks and PPE, and we'll take care of the patients. If they go to our rehab unit in Hartford is a COVID negative unit, and we take care of patients there, again, following all the CDC guidelines for protecting them from getting infected.
All right, Dr. Seetharama, thank you very much for joining us, and keep up the good work helping everybody. Thank you.
Thank you for having me.
Thank you.